Hi, it's Dr. Lewis Clark here with my friends John and Gloria. And John, you just had a follow-up with your oncologist, right?
Right.
And I want you to tell me, first of all, either one of you guys, what was his initial response? Because I know he ran some blood work, right?
Yes.
And of course, he's looking at you and you look different. You get around different, we know that. But what was his initial response to everything that he did and saw?
Well, he really said, I don't know what you're doing, but keep doing it. Because my cancer's been in remission for the last 3-4 visits, which are every 3 months.
Nice, so it's about a year almost now. Good.
Yeah, exactly a year since I came to you, because I came to you right after I completed the first round of treatments.
Yes.
And I was in bad shape.
Yes. So the first round of treatments that John had were chemo treatments because he had had multiple myeloma, which was induced from exposure to Agent Orange when he was in Vietnam. And so he was impressed with your blood work as well. What did he say about the blood work?
Well, it improves every time.
Yeah.
You know, so.
Well, and I think he also said he was amazed. He says he's always amazed at you.
Because, when I went through all the treatment and everything, he said, I've had very few patients that had all the reactions you did. You know, had all the severe reactions to the medication you could possibly have. But now, and then my immune system was it was down to 0, I guess you'd call it.
Yes.
So he's given me a couple of, in those
Gamma Goblin
I
treatments.
remember that.
Yeah, and I haven't had to have those now in probably 6 months. So, and my immune system continues to come up.
So,
which you can't fight cancer if your immune system
you
doesn't come up.
You cannot. And so you surprised your doctor in a good way.
That's right.
That's the kind of surprises you like right there.
Yeah, even all the nurses and everything, because all the other patients come in, they kind of go downhill.
Yes.
And I'm one of the few patients that kind of come in doing better every time.
I know that's an encouragement to the nurses because it's a sad thing to see when the patients are not improving like you hoped. And we were having a conversation earlier, and we were saying, wouldn't it be nice if, from when you first started the chemo treatment, if they would have known to send you over here so we could have headed off some of the things that happened to you? That would be the ideal situation. And hopefully, as you see this video, if you know someone suffering with these neuropathy type problems, has been through chemo or something else, let them see this video and know there is hope, first of all. And also, if you're doing chemo, consider getting it checked even before the symptoms show up and before they get severe, just to try to prevent some things from happening. But congratulations, you're a year down the road and way better. You're supposed to get less healthy as you get older, but you've turned that completely around.
Well, it's kind of like a 360-degree turn from last December to this December. I mean, with barely being able to walk, and then went to a cane, and then he's been without a cane about 4 or 5 months now. Yeah. So it's a complete, it's remarkable.
Yeah,
so
it's, well pleased. I also do a lot of exercise.
Yes.
Because during the cancer treatment, you become too centered, just sit around all the time. So you got to get back being active so I can do other things.
Yeah, me and John got something in common. We both like to work with cows, and John's got some cows, and you're able to get back out there and work with those guys now.
That's right, yeah. Put a hay out and everything.
Yeah, and your family's noticing a difference too, aren't they?
Right. Well, and it makes you feel better when you're able to do instead of sit.
Yeah.
Because we know sitting's not good either,
Not
but
good,
when you feel so bad,
I agree.
You don't, but the whole program, I'm saying it's the whole program. It's not just one thing,
No.
it's the
Yeah, I can't put
program.
my finger on exactly what one thing helped me, but everything together has helped me.
That's a key point, is that John jumped in and did whatever I told him, and Gloria did as well. And we used the horizontal therapy to help rehabilitate the nerves. We also used chiropractic for your back, because you had a bad back issue. We used some functional neurology to kind of get his brain working better, and we used a lot of nutrition. His dietary change and his nutritional healing was definitely a big factor, no
And along
doubt.
with all the supplements, and he does the rebuilder.
Yes, at home he's working on not only his exercises, but also doing some electrical stimulation at home to rebuild these nerves that have been damaged, which a lot of doctors say can't be done. But obviously, we know that's not true.
Yes, definitely helped.
So God bless y'all. Thank you for sharing your story again, and just that update about that good blood test and the surprise on your doctor's face. I wish I could have been there for it.
Yeah.
All right.
Merry
We
Christmas.
were very, we have really not ever discussed all what we've done. We
Yeah.
just, because I don't want anyone, I mean, a lot of times medical profession kind of, you know,
Their head, yeah, I understand. You
But-
sometimes
and
don't,
again,
you don't
it-
want to fight that battle sometimes.
you know, we did tell him that we did change our eating, but there is going to be a point where I'm going to really sit down and say, there is something that can help, because I see it in him, and maybe even if it's just one more person,
Yeah.
that's one more person that can look forward to maybe getting better.
Yeah. Well, thank you for your concern for other people. God
Okay.
bless you both, and Merry Christmas.
Merry
Same to you.
Christmas to you.
Thank you for joining us.